so many things to say about the Affordable Care Act. First of all, I'd like to preface this by saying that March 23rd, 2010 was one of the biggest days from a health policy standpoint probably in the history of our country when the Affordable Care Act was passed. And that's a day that we really need to remember. We've come through the election. I'd say there's been some serious validation that we're going to be continuing with the Affordable Care Act under President Obama. I'm not a particularly partisan guy, but I was relieved to see that we wouldn't have to retrace our steps because so much has been done and so much time, professional expertise, so many graduate students have studied this, so many nurses have planned their careers based on this, so many young doctors have prepared, health policy people around the states have gotten their budgets ready for these things. So it really would have been very, very difficult for us as a country to go back. So I was happy about that. I also think in terms of what this means to America when I think about the Affordable Care Act. I think that one of the things we've been lacking in our country for a very long time now is a common purpose. And I'm not trying to get all teary-eyed about this kind of thing, but at some point or other, our country is going to have to decide to get on the same page. Republicans and Democrats and libertarians and Tea Party guys and uninsured and insured and corporate folks and people that are struggling. We all are going to have a few ideas that we really believe in together. It speaks to the question of whether or not health care is a right or a privilege, but I can tell you this. As a country, there has to be a premise that we agree on. America is a terrific country. It's extraordinary in so many ways. But without a common purpose, we fight, we have uncertainty, we're not nearly as strong as we could be. And it's been at least my contention as a physician, as someone who spent all of my working time in healthcare, that health policy is that best place to find a common purpose for our country. And I'm very hopeful now that as we see things unfold, and we're going to talk about the details today, as we see things unfold surrounding the Affordable Care Act, surrounding the ability to get care for everyone in our country, that is the common purpose that tends to unite us rather than drive us apart. And I think it's very possible because I'll tell you, it's such an extraordinarily broad subject. And as everyone knows, the Affordable Care Act itself, Obamacare, I'm happy to call it either, is so large that really there's no one in the healthcare industry or in the country that doesn't touch it some way or other every day. And so it is an opportunity for us to find a common purpose as a country. And without dwelling on this too much, because I really want to dig into some of the details for the group today, to have healthcare for everyone, I think, is to provide psychological security for a country. I think it is the kind of foundational element that a country can have after its public safety, which is always the purview of the presidency and what's most important to most people in a country. But to have that psychological certainty that you can get health care if your child's got asthma, if you have chronic kidney disease, if you've got COPD and you don't know whether or not you're going to be able to access your inhalers and oxygen, that's no way to live as a country. It's not at all sustainable economically. We know that. We've seen how difficult it is to have a healthcare system we can't pay for. But more importantly, it's no way to live. It's no way to have neighbors living. It's no way to have family members living. It's just no way to run a country. So the most important thing from my perspective, and this is not me speaking politically, but speaking just really emotionally, being a doc, is that providing that foundation in our country, healthcare for everyone, and we'll get it. We'll get closer to right every year if we continue to work hard on this. Nothing's perfect. But as we get closer to doing the system right, our country will be able to breathe a sigh of relief. I really believe this. And to breathe that sigh of relief and then move on to some of the other big issues that exist. As a team, we can all say we looked at our neighbors, we looked at our companies and our workers, we looked at our healthcare system, and we said we're all going to be in this together. For whatever reason, whether it was economics or just people trying to do the right thing, I think it's going to make us a much better country. And I hope people will see that now that we're past a lot of the infighting, past all the elections, we can hopefully turn our attention to the details and getting this thing right. I think I'd be remiss if I didn't tell you a little bit of a election story, because we've just come through the elections. Because elections are what decide some of these things. But I'll tell you, it is a fickle world out there. And just to give people an idea of kind of how on the edge we could have been, whether you wanted the Affordable Care Act or not, I mean, some of these political periods decide which direction we're going to go. I thought I'd tell you kind of a story from the trenches. So I was out walking in my scrubs, which is probably psychological warfare against my own constituents back home. And in my scrubs and my shorts, I'm walking with my flyer. It's got a picture of me about 8 years younger than I actually am. So it gives people the wrong idea right off the bat. And because I'm cheap, I had the same picture on both sides of the flyer. And I ran into a really nice older lady. She's about 72 years old. And, I have all these things. I'm hoping people are going to read my flyer. It says, fighting for health care, all that stuff that Angela said, most of which is courtesy of you guys helping me do it 24/7 these last many years. But I'm hoping people are going to read all those things so we can get an idea. Yeah, I'm fighting. We want to get coverage for children, and we want to do the Hospital Sustainability Act, all these things that fit into the Affordable Care Act. I spend all my time. But really, people only look at that picture. So she looks at the picture, she takes it out of my hand. I'm giving it to her anyway. It says, "You look just like him. I like this young man. I think I'm going to support him." And then she flips it over. I'm trying to get a vote because I want to run the committee and do these things, right? She flips it over and she says, "He looks just like the other guy. I'm going to support this young team for my senator." I thanked her. I said, "Thank you, Aunt." I gave her a hug. "Please tell your friends about these nice young men that are in our community." But the reason to have these elections, I think, is that, because I'm looking at my calendar and I'm thinking, on the 16th I get to be here with Ken, and I get to talk about what it will mean to us as a country. And I think about what it might mean to sit in a committee again and work out the details of the health information exchange or the actual connector itself. A lot of the devil's in the details, and that's what elections are about. So anyway, I'm very happy that they supported that much younger looking guy on the pamphlets, but it is a strange process. We talked a little bit about, Angela just touched on briefly what informed me in getting into a health policy, and I've just, not to dwell on it, but my experience in healthcare I think is a little bit different than most physicians' experiences. First of all, I just finished a shift last night, and I'm going to talk about one of the cases because it's very informative about the challenges we face in the Affordable Care Act. Midnight last night at the little boy. But it's not bad. He wasn't that sick, but it's important. But when I went through medical school, I went to a med school at Penn State, which was very good. They focus on primary care, and I think I'm going to come back to that theme several times because I really think that's what the Affordable Care Act is about. As we get into the details, we'll tease out some of what we're spending with the Affordable Care Act, but the broader view of the Affordable Care Act, if you really want to know what the whole Affordable Care Act is a massive approach to move our health care away from an end-game, expensive, probably not as intelligent way to provide health care to a much better primary care-based, compassionate, broader approach to health care. And so when I went to med school at Hershey, which is where the med school is there, lived next to the Reese's Peanut Butter Cup plant for 2 years. It was not helpful for my weight, I can tell you. They focused on primary care already, and they encouraged us to go and have other experiences, and some of the good medical schools do that. It was quite a good medical school, actually. They encouraged me to go from that primary care setting to Swaziland, where I volunteered in first the Nazarene Hospital and the Catholic Hospital, both of which were ironic because I'm an agnostic Jew married to a Mormon. So, that was all very unfamiliar to me, but the prospect of seeing patients in a very, I'll use the word third world country, but a very developing country where no one had insurance, no one had access to basic care, as opposed to the residency. I was just, the medical school experience, that I was just finishing, where virtually everyone had coverage at a tertiary care setting in Pennsylvania. It was a profound difference. And I can tell you that that really shaped how I think about healthcare greatly. People would come in the mornings, you'd wake up and you would run over to the clinic about 7, just at dawn. It wasn't about what time it was or what time, no one had scheduled appointments. And a line would be stretching out for a quarter of a mile. Incredible, just incredible lines. People, everyone would come for care all at the same time. Their family members, 6, 8 people would all come, and you would take care of everyone. There was not one visit. You didn't worry about billing, ever. It was pretty much supported by philanthropic organizations, and there was no chart. It was a 3x5 card that the family carried, and the doctor would do whatever we could do with our stethoscope or the medications that were brought from the United States or that we were able to scrounge together, or the surgical procedures that we thought were necessary. And then you wrote a little note on the card, and you handed it back to them, and they went and either got the medicines or got admitted to the hospital with that one little line, or they didn't. They went home. There was no prescription. There was no nothing. And there was no medical malpractice question. There was no technology. There was only what went on between the physician and his or her patient for that brief period of time. And we provided an incredible amount of care. I was young. I had a lot to learn, but the things that we were able to do for people, when I reflect on that, were quite extraordinary. We would see, one day we saw over 240 patients that had malaria. That was, Angela mentioned that. These were quick visits, but when a kid comes in with fever in Swaziland or South Africa, which is where Swaziland is, a high fever, 103, 104, with a little jaundice, you know they have malaria, and you just have to find out how bad, and you do the blood test, and that's the visit. And then you start medicine, or you decide that they're going to die anyway, and move to the next child. So it's a very, very different experience, and I think it informs us about the differences in the cultures of healthcare around the world. What that brings me to say is that when I came back to do residency, and I experienced large charts, and every patient had an hour or 2-hour workup in the emergency department with an incredible number of tests and a $4,000 bill, which if they were uninsured, they were in deep trouble. If they were insured, they still paid 20%, and they were, I don't know if you're like me, 20% of $4,000 is still $800, and it hurts. They fixed my hernia here the other day terrifically, but I still pay $1,100, for my copay, and it's not lost on me, is what I'm saying. Whereas we are taking care of people for, I don't know, 30, 40 cents, in relative dollars, and providing very different care, but in some cases life-sustaining care. So that made a big difference to me, and it's kind of why I went towards the National Health Corps afterwards. I was interested in seeing what that side of medicine, that experience of medicine was like, and that's what I did in KAU for 4 years. And again, really extraordinary experience taking care of people. I would say it was somewhere in between an experience in a developing country and what one might get in Honolulu when you can come to Queens and have really exceptional emergency room physicians and trauma surgeons and neurosurgeons and internists and tests. So we didn't have a lab in KAU. We had X-ray 12 miles away. We had no pharmacy in Nalehu, and people didn't have cars a lot of the time. They walked in from the community, or they certainly didn't have resources a lot of the time. More than half the people in that part of the state are on Medicaid and have significant troubles paying for their care. And so, I had already some familiarity with people having difficulty getting access to health care. And so that's why I'm so passionate about us getting this right and getting it right for everybody in the country, because I think we can, and it's one of the many reasons I'm doing this and here with you today.